You're listening to Planet Vero Radio. I am Cindy Schwartz, and this is the Patient Partner Show. I've got on the show with me John and Lynn again this week. This is a second part to I'm saying a 3-part podcast because each 10 minutes goes by fast. And we're going to talk in the middle now with John. Last week we left the listeners with John is in a pretty good mood. He's going in for a surgery. John, I'll let you recap a little bit, too, in a second. He's going in for a surgery. Some of the stuff's been explained to him. He's okay with it. It's happening during the summer of 2020. So that's the height of the COVID. So some of the stipulations that they do in the surgery and the prep and that kind of thing have been skewed a little bit because COVID's a new thing. We really don't know what to do, but we're trying to do some surgeries anyway. And so, John, go ahead. And this happened at a hospital in Iowa, well-known hospital, one that you would think you went there, thinking that, everything was going to be great. And, you were happy to be there. They even got you a parking space. They gave you the pamphlets and everything to read. You were happy with that. And now, so let's take it from there, from when you go into the surgery, John. I mean, when you go into the hospital and how you feel and, what they're telling you and those kind of things. I want to set it up for the listeners about how these things happen to patients just ordinarily, where you go in and you've got all this kind of trust and then what happens. So go ahead, John.
Right. Well, thanks for having me on. All right. Like I said, as I walked in the day of the hospital, I was still in a very high mood, very feeling confident, having trust for this major hospital in the state of Iowa. It started to hit me as I walked in and was registering, exactly what I was going to have happen and then what I didn't know was going to happen. Like as you stated before, it was the summer of 20, the COVID summer. So my face-to-face preoperative meeting had to be canceled, and it was done over the phone. For a first-time surgery patient, you have no idea what questions to ask. Mm-hmm. So as I'm sitting there and they're going over the forms and things, everything was hit me, a mile a minute. I started to get the feeling, a little nervous feeling, like I'm more of a number as opposed to an individual. Mm-hmm. The people acted polite. I have to be fair.
Yeah. Did you think at that point that you had all your questions asked and answered, though? How did you feel about that?
The questions that I thought I had to ask, I had asked. I did not know, never having had a surgery before, I had no idea what to ask.
Okay.
My doctor, several months prior, in the last face-to-face meeting I had with her, indicated physically on my leg where the incision would be made. Mm-hmm. It was well below the knee. I'm like, okay. I expected, that area to be shaved. That was in the literature that they did give me. And she said, if an emergency arises, we may have to go in above the knee to get beyond the junction of the veins, if I'm saying it correctly.
Okay.
And again, I was okay with that. And I was told, I expected that area to be shaved because the literature stated incision areas would be shaved.
So like your thigh.
So at that point, I was okay.
Okay.
The initial was to be about 2 to 3 inches below the knee. If there was an emergency during the procedure, they would have to go in about 2 to 3 inches above the knee, both of them on the inside of the leg.
Okay.
So after I signed in, I was taken to the initial examination room, for lack of a better term, and then things started to really come a mile a minute. One person was going over the forms, then the anesthesiologist assistant comes in, starts talking to me about that, and I really started to get into a panic mindset because all of these things that I thought should have been answered now are coming at me that I had no answers for, and there was no time for them to answer it. Mm-hmm. I started feeling more like a number on an assembly line as opposed to an individual.
Okay. So you had like the basics, and again, for the umpteenth time, that you were new to surgery. You've never had this is a serious surgery. We're talking about general anesthesia. We're talking about parts of your body you're going to get shaved on your knee. inside your thigh, and you really don't know what to expect unless it happens. The same as the first time you ever have a baby. You don't know what to expect, and then you're like, well, I wish I would have known to ask this stuff, but you don't. And so you kind of you rely on them to tell you a lot of the stuff that's going on and to ease your mind. It's a given fact that people are going into surgeries, they're anxious. I mean, maybe there's that one person out of 100 that isn't because they've had surgeries before, or they're just not an anxious type of person. But I mean, it's a natural thing to be anxious because this is serious stuff. So now you're getting overwhelmed. And how do you feel? What do? Do you ask questions? Do you tell them you want to stop?
And I think one thing that some of these hospitals, and I'm sure they're, looking back, yes, I should have said that. But again, I was still in that mindset that doctors know what's best for me. I hadn't lost that complete trust and faith yet. It was more panic on what was going to happen. The unknown was starting to get to me. Plus, I had a friend from my hometown who went in for a routine surgery, and the anesthesia was botched. Okay. And it legally blinded him as a result. So now that starts playing on my mind. And
so say again, John, you were interrupted a little bit with some atmosphere or whatever. Say again what were you going to leave?
I wanted to. And looking back, I should have, but still, I still had trust in doctors at that point. So, okay. You're caught between a rock and a hard place at that point. I'd been dealing with this open wound on my lower leg by my ankle for a year and a half. Mm-hmm. And I was to the point, I want it done. I want it fixed. I want it,
yeah.
Healed. And I was led to believe that this would do that.
Well, it seems feasible.
So they more or less had me over a barrel.
Well, it seems feasible. I mean, did they give you any other options?
No, there were no other options given. The surgeon that allegedly did the surgery, we can talk more about that another time, said that this would cure it. This is the only way. If you want your leg fixed, we have to do this, were her words.
Okay. And this was the surgeon that you felt comfortable with, that answered your questions months before this, and you were okay to go ahead with all of this?
I am, and that's based on my own mindset. I don't like a doctor that's going to come on, and pat me on the back and give me a blanket and a pacifier and this type thing.
Yeah.
Just tell me straight up, we have to do step A, B, and C, and that will result in D.
Right.
That's the type of doctor I like. At first thought, that's what this doctor was. So I was comfortable at that point. Looking back as far as what happened during the surgery, looking back now, I'm like, wow, why didn't I see that? It just.
Well, everybody's a Monday morning.
Very frustrating.
Yeah, everybody's a Monday morning quarterback, and you can go back on your mind a million times. Shoulda, woulda, coulda. We've all done that, but you got to go forward, and you did the best with what you can at the time that you had it, and the questions that you knew to ask, and all of that. I'm just wondering. I just want you to tell the listeners. I mean, were you like scared at this point? Were you mad? I mean, all this stuff is going nonstop now, and these are all things that you didn't know about. Is that what you're telling me? And that you didn't really have the questions to ask about. So how do you feel now?
I still felt confident
until
about 2 steps outside of that first examination room. That's when hit like a ton of bricks. Like, okay, I am going in for a surgery. I've never had this. Now the panic is absolutely setting in. I was scared, to use an old phrase, shaking like a lab rat. I had at that point, it's just like they're still walking me along, and you just kind of like a sheep with a sheepdog. You just go where they lead you. Because like I said a minute ago, I wanted this fixed, and they guaranteed me that this would fix it. I'm like, whatever I have to do. If I have to wear a pink tutu and dance down the street, at that point, I didn't really care. But the panic and the fear is now setting in big time.
Okay, and I just want to clarify it. That's just a general panic and fear because you've never had the surgery before, and we only have like a couple of seconds left. I want to leave the listeners with that. It's not anything that they've done to you at this point. You're just generally panicked because this is so serious.
Right. It's and it's my first surgery of any kind outside of stitches. So yes, they have done nothing up to that point, other than kind of, hurting me through quickly. But again, they've done nothing to make me change my opinion of doctors in general up to that point.
Okay. So I'm going to stop you right there, and I'm going to say, please stay tuned to Planet Vero Radio. We'll be right back.